Innovations Fair 2022, Four Corners Care, community collaboration to increase access to eye vision care for very young children, presented by Aimee Chang-Se, developmental specialist.
Hi, I'm Aimee Chang-Se, and I'm going to be talking about building partnerships to increase access to medical eye care professionals for our students in rural areas. After moving to the Four Corners area, I soon realized that the difficulties that families faced raising their children and ensuring their development and well-being were compounded by limited to no access to specialized services and medical specialists within the community. So I am thankful to NMSVVI for encouraging partnerships because, after all, without the medical community, we would fail to see the whole child and help them reach their true potential. When the San Juan Early Childhood Coalition started, it was clear that we had some recurring themes when asked what families needed the most in our communities: childcare, transportation, and access to specialists. When my families need to go see an eye doctor, they usually have to travel to Albuquerque or Denver. It's 8 hours round trip to Albuquerque and 16 hours to Denver. If they have little kids, it may take even longer. And all of this for sometimes a 5-minute visit. Sometimes they come back saying they weren't able to test my kiddo, or we had to wait too long, so the kid had already lost it. Or, we have to go back for rechecks. Is it worth it to go? And then maybe they have to go back to pick up glasses. Families have very limited resources. Sometimes they don't have a car. If they have a car, it doesn't work. If it does work, they need gas and lodging and childcare. If they have more children, they need to take time off work, or maybe the person who usually helps them with rides has to take time off work. What happens in the end? Families either take forever to go, or cancel and reschedule, or get frustrated and don't follow up. Sometimes they tell me, Aimee, I will just not go, period. Possible solutions? Some of you may think, well, how about Safe Ride? But Safe Ride only allows one child, one parent. If they have more children, then they need to find childcare. And as we all know, childcare is a struggle everywhere these days, especially. Find a pediatric eye doctor willing to come up here. Well, it has been tried in the past, actually, but it was discontinued. The next possible option is to find non-pediatric doctors willing to see our very special pediatric population and or be trained and obtain specialized pediatric materials and equipment. In October of 2019, I went to the first local ophthalmologist office, who kindly declined. In March of 2020, the COVID-19 pandemic hit, and as all of you may know, Northwest New Mexico was especially hit hard. But it gave me time to make phone calls. I started calling local offices, both in Durango and in Farmington and all of San Juan County. I got either no callbacks, or no kids under 4 or 5 can be seen, or no dilated exams for little kids. I found 2 infancy providers in the area, one in Aztec, New Mexico, and one in Durango, Colorado. Only the office in Durango called back and said that they would see New Mexico kids 6 through 12 months of age through this program, but after that they would need insurance or Colorado Medicaid. In July of 2020, Southwest Eye Consultants of Durango contacted me. They were merging with a practice in Farmington and asked what were my needs. What was NMSVVI's kiddos' needs? They did not have an eye doctor with pediatric experience, but they were willing to work on it. So I connected them with Dr. Linda Lawrence, who has worked and continues to work on training doctors in rural areas and overseas, especially on pediatric low vision and CVI. We also had attempted to work with the Navajo Nation, but due to COVID-19 difficulties, this was just, we had to put it on hold. In February of 2021, first one of my first referrals went to infancy finally, and she got glasses and developmental progress was overnight. September of 2021, Southwest Eye Consultants hired an optometrist with pediatric experience. And by November, my first kiddo went to Southwest Eye Consultants in Farmington and got his first full dilated exam. I am happy to report that since November 2021, 15 or more kids have had their first full dilated eye exam locally. 4 have had their rechecks. 1 had to be referred to Albuquerque for a specialist. 6 were prescribed glasses. But most importantly, our families have saved on countless driving hours, childcare, lodging, and time of work. It's not perfect. It's a work in progress. But we're working together on refining our referral and scheduling process. I send a summary before the visit to the doctor. I join the family if the family wants me to join them. I follow up with the eye doctor as necessary. The doctors are now assigning 1-hour slots for NMSBVI kiddos, and gradually they are getting new pediatric equipment and materials. This is one of our little kiddos who went to see that infancy doctor between the ages of 6 and 12 months of age. He was diagnosed with CVI as he had no light perception despite having his eyes okay. He went back 6 months later for a recheck at Southwest Eye Consultants and still no light perception, but we decided to try glasses. When he got his glasses, Mom sent me this picture saying, look, first time he's looking up, and it's the first time that he looked at me. With glasses, he now shows 5 emerging visual attending behaviors. What do we hope for next steps? A low vision clinic with a local eye doctor. We have started an Eyeglasses Fund task force, working on a frames donation program, working with local optical shops to accept donated frames, and working with Medicaid to approve appropriate frames for young children. We'd like to also see maybe a pilot to start early intervention vision clinics with local eye doctors as well. Possibly further training and consultation with Dr. Lawrence, not just with Southwest Eye Consultants, but with the Navajo Nation once this pandemic is behind us. And maybe other interested eye doctors in rural New Mexico. Who knows? Thank you for listening. Please let me know if you have any questions.
This situation, is telehealth ever a possibility? Like for follow-ups, or is that not really realistic because of the young age? And
actually, I believe during when the pandemic was at its peak, I believe actually no, I know for a fact that some of my kiddos did have some follow-ups through telehealth, but still, you know, the first time at least they need to have a full eye exam. So, and you know, since we went back to normal, I believe follow-ups have not been done over Zoom unless anybody else has had any other experience. But, you know, kids are still expected to come now for in-person visits. I don't know if anyone from the Birth to 3 program knows if they are continuing to do Zoom.
I spoke with Dr. Lane here at Family and Children's Eye Care Center about a month ago, and she sort of felt like they tried the telehealth follow-ups, but they weren't very successful, right? I mean, they tried initially, you know, when it was needed, right at the height of the pandemic, but she didn't feel like it was successful, and they didn't get the needed information they really would if they did it in person.
Innovations Fair 2022 Four Corners Care, community collaboration to increase access to eye vision care for very young children. For more information, contact Aimee Changsay, Developmental Specialist, NMS-BVI email, Aimee Changsay, AI-MEECHANG-SAY @nmsbvi.k12.nm.us.